Hey everyone, it's Dr. Kevin Wafer with CORE Chiropractic in the Energy Corridor, and we're back with another Ask the Doc this week. And if you watched last week's Ask the Doc, we talked about vitamins and what vitamins I recommend for almost all of my patients. And I promised you this week we would talk about a little bit about some specific supplements that I recommend for inflammation. Now, most of the patients we see who come into the office are coming in pain, which means they have some level of inflammation. Now, I will put a disclaimer out that the two supplements I'm going to talk about today are more for chronic inflammation, so people that have been in pain for long periods of time. If you're someone who is a more acute or a recent injury, these aren't supplements you're just going to be able to take and you're going to be able to feel great right away. So it's more something you have to build up for a while before you notice a difference. The first one we'll talk about, though, is going to be one that almost everybody has heard of, and that's going to be fish oil. I find that most of my patients already take fish oil. Fish oil is great for a number of different things. Not only is it great for chronic inflammation, it's also great for people with heart issues. It's shown to be able to help with that. It's great for women who are prenatal, to take as a prenatal supplement. It's great for the development of babies' brains when they're in utero, but I love it as well as chronic inflammation. The key to fish oil is really the quality of the supplement you take, because not all fish oil is made the same. When you're looking at a fish oil supplement, you want to see the amount of EPA and DHA combined, because you might just look at a fish oil supplement and it says 1,000 milligrams of fish oil and say, hey, that's great, I'm going to start taking it. The problem is it might only have 100 or 200 milligrams of EPA and DHA. When you're looking at a fish oil supplement, you want to look to get at least 1,500 combined milligrams of EPA and DHA. Now, you're likely not going to get that all in one dose. I usually take 2 doses, but when you're looking at fish oil, really take a look at the amount of EPA and DHA, because those are the 2 great omega-3 fatty acids that are found in fish oil. The second supplement that I take on a daily basis, and I highly recommend for all my patients, is going to be turmeric. Okay, so not a lot. I'm finding that a few years ago when I would talk about turmeric, I felt like no one would know what I'm talking about. But I feel like the more, as time goes on, more and more people know about turmeric. We're finding that turmeric is one of the most powerful anti-inflammatories there are in nature. Not only is it great for inflammation, it's a great antioxidant, but also they're also finding it has great anti-cancer properties. They've done some studies of populations in India that use great amounts of turmeric in their food, and they're finding that they really don't have cancer in their populations. And as someone who cancer runs in the family, this is something near and dear to my heart, so it's something I take on a regular basis. You're going to want to look for about 1,000 milligrams a day of curcumin, which is the active ingredient in turmeric. For bonus points, if you find something that has a turmeric supplement that has black pepper in addition to the curcumin, that helps your body digest it better. It's going to be a higher quality supplement. So if you're somebody who's out there having chronic inflammation, definitely look into taking fish oil as well as turmeric. They're both great ways to help control chronic inflammation, help you feeling better. So if you have any questions about either one of these 2 supplements, or if you have questions about other supplements or anything with regards to inflammation, please leave that in the comments below. Or if you have another question you'd like me to answer in a future Ask the Doc, you can leave that as well. Hope everybody has a great week, and I'll see you next week.